So let's take a look at what this might look like for those patients with carpal tunnel syndrome. Before we move into a treatment mode, we first want to use our instruments to assess the kinetic chain. I'll start by applying a little bit of emollient. And we're going to assess both the volar as well as the posterior aspects of the forearm, wrist, and hand. When assessing, it's best to use a concave instrument to maximize your point of contact. And then I'm going to start with fairly light, slow, longer sweeping and fanning strokes, looking for abnormalities in tissue texture. Dysfunctional tissue will have an abnormal texture, and the instruments will amplify that and really tell me where I need to focus my treatment. We want to pay special attention to the pronator teres, as the median nerve runs right underneath the pronator teres. And as I sweep across that area, I do feel somewhat of an abnormal texture here. When I come into the palm, since the palm is concave, it makes sense to use a convex GT4. Now the palmar fascia is dense, irregular connective tissue. It will always feel somewhat irregular. When it's pathologic, it will feel more abnormally irregular. So I'm feeling some fibrosis here in her wrist, a little bit in the palm, up by the pronator teres. Now we'll assess the dorsal aspect of the forearm and hand. Now, to me, this does not feel quite as irregular. As I come on the back of the hand, the extensor tendons are very superficial, so I'm using very light pressure, a flat instrument angle. And most of this irregularity I'm feeling is just the periosteum of the metacarpals. All right, so now that I have a better idea of where I want to treat, we'll start up here in her forearm. Now I'm going to use shorter, faster, a little bit more aggressive strokes. Note I have a towel roll under her elbow to keep her elbow in somewhat of extension. And then again, with her hand off the edge of the table, I can control tissue tension by the position of her wrist and hand. So if I want to be more aggressive, I'll put that on more of a stretch. Now we only want to stay on one spot for about 30 to 60 seconds. We want to make sure we're not creating any petechiae. A little bit of tissue redness is to be expected. And you might even see that she's getting red right along the path of her pronator teres. If I want to get more specific, I can take my GT3 and I could do short sweeps along her pronator teres. I want to be careful not to be reproducing any paresthesias in the wrist and hand. So educate the patients to let them know if you're reproducing their symptoms. Some other techniques we can do here. To get into the interosseous membrane, a deeper structure, I'm going to remove the towel so that we can get deeper tissue penetration. I'll take my GT4 right between the radius and ulna. There's a couple of things I could do here. I could do a little swivel stroke, just using a compressive force to create some changes in the tissue. I could do a little scooping stroke. I could do what we call an interface rock with that interface scoop. So here the edge is pointed toward the ulnar aspect. If I want to go towards the radial aspect, I'll point the bevel the other direction. Interface rock and the interface scoop. Now, if she were lacking wrist extension, she's actually not that bad. But if we want to improve wrist extension, again, we'll have the wrist extended. I'll put my towel roll back. I can come further down in the wrist, again, using caution not to irritate that median nerve. We can start with sweeps and fans. As we put more tension on the tissue, this would be more aggressive. We can make our technique dynamic. So I'll have you flex your wrist and hand and then open and extend your wrist and hand. And you just keep moving. And I can proceed with my sweeping strokes, my fanning strokes. We can also do a technique called a pin and stretch. Start in a shortened position. I'm going to take my instrument bevel down and pin the tissue. Now you extend and open your hand and wrist. Good. And you just keep doing that back and forth. And I'm going to match your rhythm. Good. That's it. So I'm pinning while she's shortened, and then as she extends, she should get a stretch. From here, we can progress to a pin and glide. Keep moving. Now, as she extends, I'm going to glide the instrument in the opposite direction. Not something I would do on the first visit, but this would definitely be a more advanced technique we can progress to. Terrific. Okay. Now we're going to focus more in the palm of the hand. As to avoid irritating that median nerve, I like to start at midline and work away from the nerve. I can choke up on my GT4, and I like supporting the hand in my hand with our thumbs interlaced so I can put that thenar eminence on stretch, and we can do our short little sweeps and fans. I can extend her digits and sweep through the palmar fascia. And then I can work the hyperthenar eminence. Again, note how I'm working away from the carpal tunnel. My goal is to open up that carpal tunnel, give more space for that nerve. To get a little more specific, we can go to a smaller instrument. GT6 was actually originally designed for the foot and the hand. This single beveled concave edge fits very nicely over that thenar eminence. So here I can do some sweeping strokes. Again, I can come to the ulnar border of her hand and work the hyperthenar eminence. We can follow this all the way into the digits, working the flexor tendons, the ulnar border of the digit, the palmar surface, the radial border, and we can do that with each of the digits. This should be very comfortable. Most patients will enjoy this treatment. All right. We can get a little bit more specific on the transverse carpal ligament with GT3. Again, working away from the median nerve. So I'm going to do short little sweeps, almost like a strum. I feel a little adhesion there. I can work that more specifically. Work towards the pisiform. Good. If we found adhesions on the dorsal side of the forearm, we can certainly treat those in a similar fashion. Some techniques we can do on the dorsum of the hand. We can take our GT6, the treatment tip, and we can come into these dorsal interossei very lightly. We can also do that with the hook of GT6. We can also sweep across the extensor tendons on the dorsum of the digits. All right. Now, after our treatment, we certainly want to stretch. A very nice stretch for patients with carpal tunnel syndrome. I'm going to interlace my digits in between hers. And now from here, I'm going to splay her palm open and use my thumbs to open up that carpal tunnel. I can even use my thumbs to do some manual mobilizations. This should not be painful. Important to communicate with your patient. Make sure they let you know if you're causing pain. Again, Graston Technique should never be painful. I can come on the outside of her hand and open up the carpal tunnel. I've heard people describe this technique like you're breaking apart two popsicles. So I'm on the thenar eminence and the hyperthenar eminence, and again, just splaying that open to stretch open that carpal tunnel. And then we also want to stretch the wrist flexors. So elbow straight, and I can extend her wrist and hand and digits into full extension, and she's getting much better motion here now. And if she were lacking motion in other directions, we can stretch that as well. Very common for patients to lack supination, so we can stretch into supination to stretch that pronator teres. And then we'll follow this up with exercise. We'll cover that in our next video.